Stomach is located in the upper abdomen. When food is swallowed, it travels through the esophagus to the stomach. Once food enters the stomach, it is mixed with gastric juices which break down and digest the food. The food then moves into the small intestine to be digested further. Stomach cancer is also called gastric cancer. It begins when healthy cells in the stomach become abnormal and grow out of the control, forming a mass which is called tumor. Cancer can begin in any part of the stomach. It can also spread to nearby lymph nodes and other parts of the body such as liver, bones, lungs, as well as ovaries. Most stomach cancers are of type called adenocarcinomas. Adenocarcinoma is a broad term which describes any cancer that begins in the glands or glandular tissues that lines some of the internal organs, including stomach. Other types of cancerous tumor that form in the stomach include lymphomas, gastric sarcomas, neuroendocrine tumors, but these are very rare. In 2023, an estimated nearly 10.9 lakh people were diagnosed with this disease. Stomach cancer is fifth most commonly diagnosed cancer in the world. If the cancer is diagnosed and treated before it has spread outside of the stomach, the 5-year relative survival rate is 72%. If the cancer has spread to surrounding tissues or organs and or regional lymph nodes, then the survival rate drops down to 30%. And if the cancer has spread to the distant part of the body, then the 5-year survival rate is less than 10%. The following factors may raise a person's risk of developing stomach cancer. Stomach cancer occurs most commonly in people who are older than 55 years of age. Most people diagnosed with stomach cancers are in their 60s and 70s. Men are twice as likely to develop stomach cancer as women. A common bacterium called Helicobacter pylori, also called H. pylori, causes stomach inflammation and ulcers. It is also considered one of the main causes of stomach cancer. Testing for H. pylori is available and infection should be treated with antibiotics if found. People who have a parent or a sibling who has had a stomach cancer have a higher risk of cancer in addition to inherited genetic disorders such as hereditary diffuse gastric cancer, Lynch syndrome, hereditary breast and ovarian cancers, familial adenomatous polyposis. This increases the risk of stomach cancer. Regularly eating food which is high in salt has been linked to an increased risk of stomach cancer. This includes foods preserved by drying, smoking, salting, or pickling, or foods that have added salt. Eating fresh fruit vegetables will reduce the risk of stomach cancer. People who have had stomach surgery or those people who are diagnosed with pernicious anemia or achlorhydria have a higher risk of stomach cancer. Pernicious anemia happens when the stomach cannot take enough vitamin B12. This causes a severe decrease in red blood cell count. Achlorhydria is a condition where there is not enough hydrochloric acid produced inside the stomach which helps in digestion of the food. Those people who take tobacco or drink a lot of alcohol have a higher risk of developing stomach cancer. Research has shown that excess body weight increases a man's risk of developing stomach cancer. Stomach cancer is usually not found at an early stage because it often does not cause any specific symptoms. When symptoms do occur, they may be vague and they can be one of the following: indigestion or heartburn, pain or discomfort in the abdomen, nausea or vomiting, particularly vomiting solid foods shortly after eating, bloating of the stomach after meals, loss of appetite, sensation of the food getting stuck in the throat while eating. Symptoms of advanced stomach cancer may be one of the following, like weakness and fatigue, vomiting blood or having blood in stool, unexplained weight loss. It is important to remember that these symptoms can also be caused by many other illnesses such as stomach infection or an ulcer. In addition to physical examination, the following test may be used to diagnose stomach cancer. An endoscopy allows the doctor to see the inside of the body with a thin, lighted, flexible tube, which is called gastroscope or an endoscope. The person may be sedated as this tube is inserted through the mouth, down the esophagus into the stomach. A biopsy is the removal of a small amount of tissue via an upper gastrointestinal endoscopy. It will be examined under the microscope by the doctor called pathologist. Endoscopic ultrasound is similar to an endoscopy, but the gastroscope has a small ultrasound probe on its end. The ultrasound uses sound waves to create a picture of the internal organs. An ultrasound image of a stomach wall helps the doctor to determine how far the cancer has spread into the stomach and nearby lymph nodes, tissues and organs such as the livers or the adrenal glands. It is usually advised when the doctors are planning endoscopic removal of the small tumor within the stomach. A CT scan takes picture of the inside of the body using X-rays taken from different angles. A computer then combines these pictures into a detailed three-dimensional image that shows any abnormalities or tumor. A CT scan can be used to measure the tumor's exact size, location, and the extent. Sometimes a special dye, which is called contrast medium, it is given before the scan to provide better details on the images. The dye can usually be given either as a liquid to swallow or as an injection into patient's vein. Positron emission tomography or a PET scan, usually combined with a CT scan, that is why it is called PET CT scan also. A PET scan is a way to create pictures of the organs and tissues inside of the body. A small amount of radioactive sugar substance is injected into patient's body. This sugar substance is taken up by the cells that uses the most of the energy. Because cancer tends to use energy actively, it absorbs more of the radioactive substance. However, the amount of radiation in the substance is too low to be harmful to the patient. A scanner then detects this substance to produce images of the inside of the body. A laparoscopy is a minor surgery in which the surgeon inserts a thin, lighted, flexible tube, which is called a laparoscope, into the abdominal cavity. It is used to find out if the cancer has spread to the lining of the abdominal cavity or the liver. A CT or PET scan are often not able to find very small tumor deposits in the abdomen, so where the laparoscopy has an added advantage. Biomarker testing may be advised for certain genes or proteins which is performed over the tumor tissue. For stomach cancer, testing may be done for PDL1 and microsatellite instability, MSI-H to be specific, which is also called mismatch repair deficiency. Testing can also be done to determine if the tumor is making too much of a protein called human epidermal growth factor receptor 2, HER2, particularly if the cancer is more advanced. The results of these tests will help the doctor to find out if immunotherapy or HER2 targeted therapy is a treatment option available. Stage 1 and stage 2 in stomach cancer means that the tumor is confined within the wall of the stomach. In stage 3, the tumor has spread to the surrounding lymph nodes. In stage 4, the tumor has spread to the lymph nodes which are outside the normal drainage area of the stomach, or it has spread to the other organs such as peritoneum, liver, or the lung. Treatment plan for stomach cancer patient will usually be decided by a team of doctors, which is why this is called multidisciplinary management. The different modalities of treatment are chemotherapy, surgery, radiation therapy, targeted therapy, and immunotherapy. Surgery is the removal of the tumor and the surrounding healthy tissues during an operation. The type of surgery used depends upon the stage of the cancer. For a very early stage like T1A cancer, treatment which is called endoscopic mucosal resection or endoscopic resection is the treatment of choice, which is where the tumor is removed by an endoscopy. In early stages like stage 1, when the cancer is still only within the stomach, surgery is used to remove the part of the stomach with the cancer and the nearby lymph nodes. This is called subtotal or partial gastrectomy. In a partial gastrectomy, the surgeon connects the remaining part of the stomach to the esophagus or the small intestine. If the cancer has spread to the outer stomach wall, with or without having spread to the lymph nodes, surgery is preceded by chemotherapy. The surgeon can perform a subtotal gastrectomy or a total gastrectomy, which is the removal of all of the stomach. During a total gastrectomy, the surgeon attaches the esophagus directly to the small intestine. Regional lymph nodes are often removed during the surgery because the cancer may have spread to these lymph nodes. This procedure is called lymphadenectomy. The types of medications used for stomach cancer treatment include chemotherapy, targeted therapy, and immunotherapy. Chemotherapy is the use of the drugs to destroy the cancer cells, usually by keeping the cancer cells from growing, dividing, and making more cells. A chemotherapy regimen or a schedule usually consists of a specific number of cycles given over a set period of time. A patient may receive one drug at a time or a combination of different drugs given at the same time. The goal of the chemotherapy can be to destroy the cancer cells remaining after the surgery, to slow the tumor's growth, or to reduce cancer-related symptoms. It also may be combined with radiation therapy sometimes. Currently, there is no single standard chemotherapy treatment regimen that is used worldwide. However, most chemotherapy treatments for stomach cancer are based on combination of one of the following drugs like cisplatin, oxaliplatin, and fluorouracil. Your medical oncologist will be the correct guide for the best line of chemotherapy for the patient. Targeted therapy is a treatment that targets the cancer's specific genes, proteins, or the tissue environment that contributes to the cancer's growth and survival. This type of treatment blocks the growth and spread of the cancer cells and limits damage to the healthy cells. Not all tumors have the same targets. To find the most effective treatment, your doctor may run tests to identify the genes, proteins, and other factors in your tumor. This helps the doctors better match each patient with the most effective treatment whenever possible. In addition, research studies continue to find out more about specific molecular targets and new treatments directed at them. Targeted therapy for stomach cancer includes HER2 targeted therapy and anti-angiogenesis targeted therapy. Some cancers may make too much of a protein called human epidermal growth factor receptor 2, HER2. This type of cancer is called HER2 positive cancer. Trastuzumab plus chemotherapy is an option for people with later stage of HER2 positive stomach cancer. Anti-angiogenesis therapy is focused on stopping angiogenesis, which is the process of making new blood vessels. Because the tumor needs nutrients delivered by the blood vessels to grow and spread, the goal of anti-angiogenesis therapy is to starve the tumor. For patients whose tumor has grown while receiving initial chemotherapy, these medicines may be an additional option and may be given either in combination with paclitaxel or by itself. Immunotherapy uses the body's natural defenses to fight cancer by improving the immune system's ability to attack cancer cells. For people with advanced HER2 negative, PD-L1 positive stomach cancer, treatment with the immunotherapy like nivolumab in combination with chemotherapy is preferred. Nivolumab is a type of immunotherapy which is also called immune checkpoint inhibitor that helps body's immune system target and destroy cancer cells. For patients with advanced stomach cancer, that is MSI-H, pembrolizumab, nivolumab, and dostarlimab are options when chemotherapy does not work. Different types of immunotherapy can cause different side effects also. Common side effects include skin reactions, flu-like symptoms, diarrhea, hypothyroidism, and weight changes. Talk with your doctor about possible side effects for the immunotherapy which is being recommended.